Hi everyone, my name is Gloria, and today I'll be doing my presentation on the opioid epidemic that's going on in the United States. So what is the opioid epidemic? The opioid epidemic is basically the misuse of opioids and painkillers that are being prescribed by physicians. You can basically get this kind of medications at your doctor's office or after surgery. Many of you will be familiar with this kind of medications. They're medications like oxycodone, methadone, fentanyl, codeine, and hydroxycodone. Just to give you guys a few stats about what's going on with this crisis, about 30% of patients who are prescribed these kind of medications do become addicted to them. And in 2016, about 2 billion people were actually addicted to some form of opioid or prescription. And then around 175 people were dying every single day in the United States because of a drug overdose or complications due to the misuse of these kind of drugs. Because of this, as everyone can assume, there are a lot of burdens in the United States. There are a lot of economic burdens. There is an estimated amount of $78.5 billion a year due to the opioid epidemic. All of this includes factors like the loss of productivity from people not being able to work, people not being able to be constructive to society because of this, people being having to be put in like rehab and addiction treatments and programs and stuff. And then also, of course, the use of law enforcement when addiction treatments don't work. And then just to give you guys a little snap, about 80% of heroin users were at one point addicted to opioids. So one of the regulations that the state of Nevada is trying to do to fix this issue is Regulation AB 474. It attempts to fix the issues at the source because, as we all know, physicians are the ones prescribing these medications, so they're trying to basically fix this at the source. Physicians are basically required to self-query every 6 months, and they are required to have extensive discussions with their patients about the side effects of the drugs and about how potent these drugs are at becoming addictive. And then they also have to include every single drug they prescribe and any kind of overdose or even suspicion of overdose into a database. The pros and cons of this, so let's start with the pros first. Physicians are going to have better relationships with their patients as they're going to be able to explain to them the side effects of the medications better, and they're just going to be able to spend more time with them. Of course, there's going to be less opioids on the market because doctors are the ones that are prescribing this, and if they're having to do a bunch of more work just to prescribe these medications, they're going to be less likely to want to prescribe these medications. This also eliminates candy doctors. For those of you that don't know what candy doctors are, they're kind of doctors that you kind of can even give cash to, and they'll prescribe you whatever kind of opioid that you're looking for. A lot of it's like ibuprofen, oxycodone, and stuff like that. And then it's also going to be, like I said, it's also going to be combating the epidemic at the source. It's going to be getting straight to the point. If it weren't for doctors prescribing all of these drugs as easily and at such high rates, we wouldn't have as much drugs on the market. Cons of this, of course, everyone, just like what we learned from the lecture, physicians don't have enough time as it is to sit with patients. There's already long waiting periods, especially here in the Valley. For anybody who does visit a doctor regularly knows how hard it is to get an appointment. There's a lot more paperwork. We also learned a lot about how doctors are already burned out with the paperwork and they already feel overwhelmed. So I feel like there's going to be doctors that don't even want to come to the Valley knowing that they have to do so much work just to prescribe an oxycodone pill. People who might actually need it might have to wait even longer to receive these medications, and then there are just so many mandates that we have to adjust to and that organizations need to be prepared for, which leads us into the next slide. How will this affect my organization? Like I said, physicians don't have enough time as it is. They're probably not going to be happy about this. They're not going to be happy about all the paperwork that they have to do. They're probably going to have to learn something else. They're going to have to learn new data entry skills. And then, of course, the staff is going to need training for all its staff. They're going to have to talk to patients that are probably just used to getting the medications right off the bat. They're not going to be able to do that anymore. And then, like I said, there's so many mandates to follow. They need to be careful. I also read that if physicians and healthcare providers fail to do these guidelines from the Regulation AB 474, it could be considered a misdemeanor. So there are just a lot of things to process with this new law, and there's always going to be pros and cons with everything. And these are my references.